the form of selenomethionine. So, similarly, we don't know what component of the oral nutrition supplement actually benefits the patient. It may be the fish oil, maybe the arginine, we don't know. But evidence is very, very clear that 7 to 10 days of preoperative oral nutrition supplement in an elective patient, in an elective operation, always works. Now, you might say it is okay for GI, as we heard earlier, but then hip replacement, which has nothing to do with the GI tract, those patients go home sooner and start mobilizing sooner. You'll start scratching your head wondering, what does the hip have to do with the GI tract? It is true. That is why this has been extrapolated to cardiac surgery and to joint replacements, all kinds of surgery, wherever possible, at least a minimum of 7 days. Now, the reason why we have difficulties in following this and why it has taken 20, 30 years is we have a lot of misconceptions in our mind. So some of us practice in really fancy-dancy hospitals like in this neighborhood and say, how can my patient be malnourished, correct? They come in a Mercedes-Benz car. How can they be malnourished? They come from the Middle East in a first-class plane fare or a private jet to my hospital. How can they be malnourished? My friends, each one of us in this room, including me, can be malnourished by 5 o'clock this evening, if you look at the new definitions of malnutrition, which I am going to tell you. So there's a confusion as to what it means by malnutrition. Everyone thinks it is different. It is, we think about the skin and bones child in Africa who might be malnourished. So we don't understand what is malnutrition. If you have a patient with head injury and you say, I'm not going to treat it, that's not good medical practice. But we don't even know what malnutrition is. Everyone has their own definition. So the diagnosis of malnutrition is not recorded in the patient's records, in the patient's medical records, and therefore it is not treated. So once you recognize malnutrition easily, then you have to treat it because you have a disease and then you have to treat it. The WHO definitions are heavily based on weight, but it does not capture muscle wasting or disease-related malnutrition or sarcopenia. That has been a huge problem. So I wish the diagnosis of malnutrition was black and white. I really worry about the obese patient who's malnourished, because you go and tell an obese patient you are malnourished, the patient's family will laugh at you because they don't know about sarcopenia. You see, and there are no practical methods of detecting sarcopenia. This ultrasound is a fantastic thing, great research project for those of you who are interested. Unfortunately, just across the ocean in Malaysia and in Singapore, dietitians do the ultrasound. In India, only physicians can touch the ultrasound machine by law. Nobody else can touch the machine. So it's always easy to get a physician to learn how to use ultrasound of the quadriceps muscle. Now, in simple starvation, it is the ketone bodies that are left from fat. If we don't eat breakfast and we don't eat lunch, when we go home, we have a peculiar smell in our mouth. Those are ketone bodies from fat. It is an adaptation. But when we get infected or septic or stressed, fat doesn't get broken down.